Our next speaker has had quite a journey in the past year. She came to the conference last year because she's the wife of one of the speakers of last year, Dr. Simon Tobin, and she became informed about a lot of things from last year's conference and then implemented it into her place of work, which is a hospice. And she is the medical director of that hospice. Please welcome to the stage Dr. Paula Powell.
Thank you very much. I'm very pleased to be here. As Sam said, I'm the medical director of Willowbrook Hospice, which is on Merseyside. These are the wonderful gardens that you can see here. Willowbrook is a 12-bedded inpatient unit for people who have life-limiting conditions of all causes. We're placed in St Helens and Knowsley, and we cover a population of about 340,000. So we have a 12-bedded inpatient unit, we have an outpatient service and a wellbeing service. As I said, note to self, by the way, when you're choosing a picture, you forget that it's going to be absolutely enormous when you're doing the presentation. So who am I? So I'm Paula Powell. I've been a clinician for 30 years, just this year. I started out life as a GP and ended up in palliative medicine over a period of time of combining general practice and palliative care, and finding it was the thing that I felt made the most difference to patients. I always say that palliative medicine is the thing that you can use to help people to make a difference to people when they feel no difference can be made. So I've been the medical director and one of the exec team at Willowbrook Hospice now for 3 years. And I'm also responsible for a huge number of staff and volunteers. So not only am I responsible for ensuring the care and providing the best care possible for our patients, I'm also responsible for trying to support the well-being and resilience of a group of staff and volunteers. So we have 103 staff across the whole organisation, and that includes fundraising and trading company as well. About half of those are our clinical staff, and we have 500 volunteers. These are some of the great people I work with, and one of these, the young lady in the pink jumper, will appear later as well. So these are my reflections on a year. There's no charts. This is just me telling you what I've done in the last year to try and support my staff when I found that they were in difficulty. So this is the question: can you lead by example and support change that has an impact on individuals and teams? So I've got some declarations of interests. I have no declared interest with regards to Big Pharma, although I do prescribe shed loads of opioids. I'm not linked to anybody. I do know a few people in the know, one of which you might... Low-carb GP. Do you want to go back and just have another quick look? I've known David and Jen and Wynne for many, many years, over 20. And I suppose I've been on the low-carb journey to a degree with David and Jen and my husband. So just telling you a little bit about my journey to low-carb. About 6 or 7 years ago, my husband Simon, who is in partnership, or was at the time with David, started on the journey that has been described to you in terms of understanding the impact of low-carb diets on patients. And Simon would come home to me and David would bore us to death over dinner, and eventually the messages started to get through to me, even though I railed against it for a bit, to be honest, because I had a full-time job, 2 teenage children who lived for carbohydrate, and a husband who then added into the mix, I don't really want to eat the carbs if you don't mind. And so that was all a bit of a, oh my God. But I eventually found my own way to low carb. And in doing so, I no longer have irritable bowel syndrome. I had it for 25 years. It affected me on a daily basis. I took omeprazole daily for many years because I have reflux. I don't take it at all, hardly now. So it's had a huge impact, I think, on my health. And then knowing all of this and becoming the new medical director at Willowbrook, I also spent time with my team over coffee after we'd had the ward round and things like that. And I was hearing them tell me things about how they felt. Familiar things, I'm sure, that you've heard other people tell you, that they're tired all the time, struggling to lose weight, feeling bloated, know they were eating badly, but didn't know how to change that. And I was wondering to myself, how can I help? What can I do? Is there anything that I can do to help my team? But we are really up against it. What we know is that health professionals are under an enormous amount of stress on a daily basis. And this definitely, in my opinion, has an effect on their nutrition, both at home and in work. But in particular, I think, working in a hospice is a particularly challenging and stressful environment. So when you have spent the day setting up a wedding for a young man so that he can marry his partner and the love of his life in the hospice because he's not well enough to go anywhere else, or when you have helped somebody create something to leave behind for her children, or when you have sat, as I did recently, with the mother of a 20-year-old boy, the same age as my son, and told her that he wouldn't be 21 next week. You will eat the biscuits. And this is a fairly typical scene in our nursing station. So I took this a few months ago. I came into the office and this was what was on the desk. This is just 2 grateful families leaving thank yous behind. But usually they choose to leave us these kinds of gifts, chocolates and cakes and crisps and sweets, because they think that's what the team need. And so when you've had that kind of day and you come in at the end of your shift or you're having a coffee break and that's what you've got there, you're going to eat them. And you're going to eat the chocolates and the crisps and the cake, and you're going to, if there aren't any in the nurses' station, you're going to raid the vending machine, which is in our cafe. So can I ask, will you stand up if that has resonance for you as an individual? Have you ever had a stressful day and then eaten the cake and biscuits? There's the odd person still sitting down. I'm not entirely sure I believe them. So sit down. If you are a health professional working in a team, can you stand up if you recognise this challenge? Great. I didn't think I was on the wrong lines. Okay, so I have a fantastic team of people working alongside me, and we'd already been thinking about how we could develop a holistic approach to supporting staff well-being, to help support people to feel resilient and be well. And one of my team, Kelly, is a fantastic holistic therapist. And she has been doing a project for us over the last couple of years looking at how we can support all aspects of well-being for the staff. And this is just an example of the first 6 months of our annual staff safety and well-being planner. So the kind of things that we might be doing to support people across the year. You probably notice that if there's anything to do with food, it's not necessarily low carb, but we're working on that. Okay. And then each month, Kelly will do a well-being, this type of thing where sort of April is surviving and thriving. And so this is on a board in our ward. And that's shared with patients and families as well. So coming back to why I'm here, so a year ago, I was here in the audience, as you are, listening to some amazing presentations in the same vein as we've had today, and realizing that the knowledge that I had accrued about low carb and previously and last year was something that I needed to think about taking back with me, because I knew from what people were telling me that they were feeling unwell and they were feeling tired, and they had this huge burden, this huge challenge of emotion and emotional eating to deal with. So I have a confession to make, which I only realized would be a confession earlier. So last year, I snaffled a huge load of these. Okay? And I've been told today that I can only have one of each. And it may be because last year I took a whole load of them back with me. So I decided to take all of those information leaflets back with me to the hospice. And this one in particular, which is David's sugar infographic, I just left them everywhere around the hospice. I left them on people's desks and on coffee tables. I plastered them all over the nurses' station next to the biscuits and things like that. And then people said to me, Paula, what were you doing over the weekend? What is this? What's this public health collaborative? So I started to tell them. And I started to talk to them about my low-carb diet and how it had impacted upon me. And people started to ask questions and say, how can it possibly be that basmati rice has got so much sugar in it? And started to want to know more. So I thought, well, maybe I should actually give them the opportunity to understand more and give them some information. As we've talked about this morning, education and information is absolutely key in people being able to take responsibility for their health. So one of the first things I did was I did a presentation at everyone's request. I didn't make people come. We have a lunchtime education session each week, and so I used that. And I stole some slides from both David and Jen and Wynne. And we all know this, but what I did was a number of things in that session. I gave them some information about the science behind low carb, as you're all very aware of. We talked about the psychology of wanting to eat high carbohydrate food when you feel very stressed, and we talked about that and shared those challenges. And one of the things that I often say, and they get used to me saying now, is that nobody ever really felt better for eating a donut other than for about 10 seconds. And then afterwards, you just really don't feel great. And it was about things like sort of getting people to think about that and notice that. But this is Jen Unwin's fantastic 4 stages, which is called GRIN, which is thinking about what your goals are, working out what resources you might have to support you, agreeing incremental next steps. And that's another thing that I think has really made a difference to people is that They don't have to see the top of the mountain if they think they've got a huge amount of weight to lose. We talked about starting at the bottom and going up step by step and thinking what your increments might be. And then when you get there, notice what that feels like. This has really become embedded into the thinking of my team now, I think. It's got a bit of a way to go, but they get it. The other thing I did was decided to sort of help support them with just some really simple messages like we've been hearing today, like eat real food, don't eat the processed rubbish, avoid the white carbs, avoid the bulking agents. Again, another thing that people have found they've engaged with quite a lot is, what is the rice there for? Because it's not adding any nutritional value to that plate of food. So if you can replace that with something else that's of nutritional value, then that's a much better plate of food for you. It's a bulking agent, pasta, rice, potatoes, etc. They get that. So we came up with some really key messages together. This is not a diet. This is a lifestyle change. You don't have to be a chef. Lots of people really worry that this requires you to be able to make very complicated recipes. It really doesn't. A lot of it is just swap outs. Understanding what hopes you might have, when you engage with what your hope might be, then you can find it within you what you need to do to get there. Another simple message was just go green, keep away from the brown, and notice when you feel better. I sat with a colleague the other day, and she'd fallen off the wagon. And I said, well, tell me about when you were really doing the low carb, how were you feeling? She said, oh, so much better, I had so much more energy, I was sleeping better and what have you. And I just did what palliative medicine doctors do quite a lot, which is just said nothing and listened. And she went, I need to get back there. And go again. So what happened next? Well, people were energized and interested and informed, and they wanted to keep the momentum up. So we developed a group, and we've got a WhatsApp group which supports this called What the Fat. I hope there's no intellectual property rights attached to that, but probably is. But, so we call ourselves the What the Fat group. We are about 25 of us on the WhatsApp group, and we share recipes, we share challenges, we share incremental goals, and we share successes. And that has been a hugely successful way, I think, of maintaining the momentum. And I find myself on Saturday night when I'm cooking, I don't do Instagram, and I've never taken an Instagram photograph of food, but I take quite a lot of photographs of food when I'm cooking, just to share with the team that, you know, you can have really delicious things. And I've photographed quite a lot of the Caldese things that I've been cooking recently as well. So the What the Fat group had decided that they needed to do something to change the whole hospice, because what they were being offered to eat was really not acceptable from a nutrition point of view. Lots of carbs. If anybody is from anywhere near St Helens, Pimmy's pies are famous, and that was generally what was on offer. So some of our successes. Don't look too closely, there is quiche on there. So this is in our cafe, and this was previously filled with cakes and sandwiches. We never had any kind of salad bar. You could have a sandwich with a little tiny bit of salad on the side, but if you asked somebody for a salad, they just looked at you with sort of incomprehensible look on their face. So we, as a staff team, got together with the catering team and said, we'd really like some salad, please. This has been really successful, and the sales of sandwiches and pies have gone right down. They're still being sold, but the salad bar is really, really successful. You may have seen earlier that in the vending machine, there was the usual selection of sugary drinks. So we started to invest in these simple containers and put water, as we have today, with fruit in around the hospice. And certainly in the summertime, that's been really successful. I came in the other day, and this had happened, and I can't tell you how pleased I was. So, obviously the celebrations were eaten before it was empty. But somebody had thought to bring in some fruit and put it. But we actually we now have fruit bowls around the place, which do include bananas, but I'll tell you a little bit more about that later. So, the other thing that we did was we decided to get together and share our low-carb diets and our recipes with the rest of the staff. And so we offered a free real food lunch, which we had a couple of months ago. And we were really, really lucky to have a very famous speaker. Luckily, he came dressed as he is now, as opposed to how he had been in the past. So David very kindly, and Jen, very kindly came to our real food lunch. I know it's quite dark, that picture, actually, as it's come up. But as you can see, the staff are totally fascinated by what he is saying. Particularly the poor young medical student who's there, who got a bit of a grilling, but did quite well on starch, actually. He did know what starch was. So I want to then tell you a couple of little stories about two of the staff. These are just examples. There's lots of these examples. So Karen is one of my PAs. I've worked with her for over 10 years because I was the consultant in the community before, and she was my PA there. She's a long-term vegetarian, and she would tell you that she was a vegetarian with a terrible diet before. And she'd always been yo-yoing up and down in terms of her weight. But she's now, in the last year, lost 1.5 stone and totally kept it off. Her irritable bowel syndrome, like me, has completely gone. And her and I would moan about this on many an occasion previously, before I got to low carb as well. She's substantially reduced fatigue. And she said to me the other day, you know what, I don't recognise my food trolley from how it was before. And she loves the fact that she eats fresh vegetables, etc., rather than pasta, etc. The other person I want to tell you about is Susie. Susie is in the middle here. She's an absolutely fantastic nurse. This is a photograph that was taken at, I'm going to blow our trumpet here now just for a moment. So this was taken at the HSJ Awards last year. We were also in the final of the BMJ Awards for the work that we've done as a team on treating delirium in the hospice. But that's an aside. So Susie is somebody who struggled with her weight her entire adult life, despite being brought up by a mother who was a fantastic cook and gave her healthy food all the way through. Suddenly she got to 18 and just hit the carbs big time, and she just couldn't ever sustain weight loss. So Susie, also a vegetarian, has chosen low carb as a way of eating, and she's taken off 1.5 stone and maintained that. Again, she feels so much better. She always had aching knees, and she doesn't anymore. But she's changed her family's meals as well. So she has changed the diet of her children. Their meals are focused completely away from white carbs now. And her children have protein-based snacks instead of sugary drinks and snacks, etc. And she doesn't actually give them fruit anymore, which is quite unusual. So then what else? Well, a bit of a straw poll. I think across the team, we've probably lost about 20 stone in total. And that's just in a year. The team, it's really had an impact on teamwork and team building. And this says morale. It should have said moral support, but I suppose the two of them are the same. People look after each other, care for each other, share their challenges. They share when they've lost the weight and put it back on again. And then people say, don't do that, get back on the wagon and let's go again. They share resources, so we're just about to set up a little library with lots of books in so that people can go in and out and take them away or photograph recipes and things like that. They tell me that overall they're feeling so much better, and they're mindful and they notice. So I notice when I don't eat the donut that actually I feel better. And they feel really armed with information. Even the ones that sort of maybe choose not to follow what we're doing with the low carb, they know the information. And then somebody just this week said to me, well, I think it's fantastic because I haven't had a sugar stick for a year. So bananas are definitely off the agenda in my organisation now. But there's been a ripple effect too. So people have also been telling me what's been happening at home with husbands. So one of my colleagues' husbands, his HbA1c has been travelling upwards for a good bit of time until she went and she said, I am sorting you out now. And as you can imagine, it's now going back the way. People have also been talking about their parents' health. The chap was here earlier with the father with type 2 diabetes. They're going away and saying, my parents have both got diabetes, I need to go and sort them out. Many people are changing their children's diets and focusing them away from the sugary treats, etc., etc. And they're talking to friends about it. So I think it's not just about outcomes like loss of weight. I think it's about how people feel and what they're saying to other people. So I do sometimes feel like the chocolate police. In fact, I've been called the chocolate stealer. Having said that, I've never stolen any chocolate. But so I suppose my reflections on a year from this time last year in terms of going away and thinking, can I do something to help support change? Well, it definitely keeps yourself away from the carbs, because there's absolutely no way I could be eating a biscuit and be found out in the office. But I've had a huge sense of satisfaction when I look back at, I think, what the impact has been and then ultimately could be in a small organisation. It's hugely satisfying. I think a challenge has been keeping up the momentum. So I tell you, the WhatsApp group went very quiet over Christmas and then Easter. But I sort of put a few things back on WhatsApp and say, how are people going? And, anybody done well recently? And they all go, oh, yes, and we get back on track. But it's hard to sort of try and maintain that kind of enthusiasm. I suppose one of my reflections would be that there's a bit of a rule of thirds is what I've seen happen. So probably about a third of the people that started out being interested have really made a change and value that hugely, and they're not stopping now. About a third have been a bit in and out, and they're dipping their toe in the water but coming back again. And about a third of people have sort of declared that low carb is definitely not for them. But I think they still got the information, so I suspect that at some point they may come back. So what next for us as a team? Well, we're going to Real Food Rocks, as Jen said, in July in Ambleside, and I'm taking the team with me because I want them to share their stories. I'm doing it on our behalf today, I suppose, but they're living their stories and their challenges. And so in some ways, I think it's time maybe for me to step back a little bit. I've been the instigator. I've got a number of followers now, and I think they can take things forward. So I suppose a final reflection would be, and a final challenge to you is, we're all armed with this information, and we know that eating well, eating real food, thinking about becoming more low carb can have a huge impact upon well-being. And we know that we work alongside and with people who may not have that amount of information or be feeling unwell, etc., by virtue of their diet. So my challenge would be to say it is possible in a year to make change and to impact upon people's lives and to help them make changes for the good in their own, in sort of nutrition. So perhaps go away and have a think about what you could do in your own team or organisation to make a change.